It's good to be back with all of you. Over the summer months, our faculty, staff, and students have been gradually returning to our campuses. In just a few weeks, we will have welcomed our community back. This is a very exciting time for all of us. Earlier this month, courses began for our School of Medicine and some of our graduate programs. Undergraduate students are arriving for pre-orientation programs. Our fall sports are beginning team practices. Our class of 2025 is preparing to move in. With the arrival of our new students to our campuses, there is an energy that all of us look forward to each year. This fall, there is even greater excitement as we welcome back our colleagues who have been working remotely this past year. There's also a sense of trepidation, questions about what may unfold over the coming months, not just at Georgetown, but around our country and our world. I wish to take a moment to review our fundamentals, the key elements of our layered public health approach that will help to protect each of us as individuals and our broader Georgetown community. The steps that we take right here on our campuses to protect the health of our community have an impact on our surrounding communities. And what is happening in our surrounding communities impacts us. Towards the end of our presentation, I will share some additional context on the current state of the pandemic and the Delta variant, now the dominant strain of COVID-19 here in the United States. And Dr. Ranit Mishori will join me to offer her perspective as our Chief Public Health Officer. We will discuss our preparations here at Georgetown. Throughout the pandemic, our highest priority has been the health and safety of our community. Over the past year, on a number of occasions, I have described our layered public health approach. A layered public health approach works by combining the best tools we have to fight the virus, implementing and refining these various strategies gives us the strongest framework for protection. Let me describe 4 recent decisions we have made to support our layered public health approach. First, vaccination. This is now the most powerful tool we have to fight COVID-19, protecting ourselves from severe disease and contributing to the overall protection of our community by reducing transmission. In April, we announced that we would require all students to receive a COVID-19 vaccine. In June, we extended this mandate to our faculty and staff. Masking, another important means of protection. In mid-July, in a message detailing many aspects of our fall planning, we extended our indoor mask mandate. All members of our community, regardless of their vaccination status, are required to wear a mask indoors. On July 29th, the DC Health Department reinstated its indoor mask requirement for the District of Columbia. Ventilation. We know transmission can be airborne. Over the past months, we have assessed and enhanced ventilation on our campuses to respond to the airborne nature of the virus. And finally, testing. All members of our community will be tested upon arrival back to our campuses, and we have a testing program in place for those that are unvaccinated. We are prepared to expand our testing program if necessary. We are tracking the number of positive cases closely, and we are continuing to review our public health protocols for any possible adjustments. When a member of our community tests positive, our public health team, known as our care navigators, steps in. They support each aspect of the process: isolation for those who test positive, contact tracing to identify close contacts, and quarantine for those exposed to the virus. They also help us monitor those in our community who may have the symptoms of COVID-19 and encourage them to get tested. Anyone in our community who is concerned about possible symptoms associated with COVID-19 will have access to free testing. We are continuing to closely monitor the pandemic. When we look at the national context, we are seeing a wave of new cases and hospitalizations across the United States. This represents the fourth surge since the pandemic began. More than 80% of infections in the United States are from the Delta variant. As we monitor these developments in the pandemic, I've invited Dr. Ranit Mishori, our Chief Public Health Officer, to provide us with some information on the current state of the pandemic and a deeper understanding of the Delta variant.
Dr. Mishori, thank you so much for joining us for another conversation. This is an especially exciting time as we welcome our students, faculty, and staff back to our campuses. And we're so grateful to you for all that you and your team have helped us to do to prepare for this fall semester. I'd like to first start with vaccination. The COVID-19 vaccines that were developed have proven to be highly effective. With the emergence of the Delta variant in the United States, what do we know about the continued effectiveness of vaccines?
Thank you for having me again, Jack. It's really a pleasure, and I really am happy that we can help dispel some of the fear among the listeners. And I know there's a lot of uncertainty at the moment. But one thing that I want to definitely make clear is, as you said, that vaccines are very, very effective. They're highly effective in preventing transmission, but primarily they're effective at preventing hospitalization, severe disease, and deaths. And if you look at the data that's come out in the last few weeks, you can see very, very clearly that among all hospitalizations, greater than 97% of them are among people who are unvaccinated. If you look at the death rates that have been reported due to the Delta variant, you can see that 99% of them are due to people who are unvaccinated. So that suggests that the vaccines are highly, highly effective in preventing those really, really bad outcomes. And also recently, both Pfizer and Moderna and J&J have released studies that show that they're very effective in preventing and transmission itself.
Now, we are a vaccinated campus. As our students, faculty, and staff return, our expectation is that everyone will be vaccinated. We will have a limited number of medical and religious exceptions as permitted by law. Nationally, we're seeing some evidence that there are breakthrough cases when someone who is vaccinated tests positive for COVID-19. Could you talk about the prevalence of these cases and what it means when someone who is vaccinated still tests positive for the disease? What differences might we see in our community with our high vaccination rate compared with the national vaccination rate?
Yes, so no vaccine is 100% effective, and that applies to the COVID vaccines and all previous vaccines that came before it. And so breakthrough infections are expected. We've seen them with the Alpha variant. We're seeing them now with the Delta variant, of course. And so I think that the notion that we shouldn't have any breakthrough vaccines is not realistic. We do know that the Delta variant is more transmissible, that even fully vaccinated people can carry a lot of virus in their noses and in their mouths. But I think that what is important to note and to remember is that even if you have an infection and you're fully vaccinated, the likelihood that you're going to be very, very sick is much lower. The likelihood that you're going to die is much lower, that you're going to be hospitalized is much lower. And we see a little bit more cases where people who are fully vaccinated with the Delta variant have some symptoms versus in the past, for example, with the Alpha variant, fewer people who were both infected and fully vaccinated had symptoms. Those symptoms can be misleading. Sometimes they just involve a runny nose or a slight cough or maybe a little bit of a sore throat and can be mistaken for other things, which is why even though we have a very highly vaccinated campus, we are going to urge anyone and everyone that if they have any symptoms, don't think that it's an allergy. Don't think that it necessarily must be just some other virus. Come get tested and let's make sure that it's not COVID, and then we'll let you go on your merry way.
Now, vaccines provide important protection, but there are other public health measures that are important in combination with vaccination. This is in part to address the possibility of breakthrough cases and reduce the overall presence of the virus in our community. Share with us, how does a layered public health approach work? And why are all these other steps important?
So you probably know the Swiss cheese analogy, which is really wonderful and very apt when it comes to COVID. It means that every slice of the cheese has little holes in it. No slice is fully protective, so no layer is fully protective. But if you stack them up one next to the other, I think we can offer enhanced prevention mechanisms and measures that will protect a larger proportion of the population and of our community.
I'd like to close by asking you about our care navigators. We've talked about the terrific work of our care navigator team on a few occasions. As our community returns to our campuses, our care navigator team can be a resource on a range of COVID-19 public health related issues. Could you describe for us the range of things this team is working on? Not just on isolation and quarantine issues, but also to support the day-to-day public health of our community.
Yes, thank you for asking about our team. This is a team of highly dedicated individuals who've been trained to do a number of things. Number one is to do contact tracing. So if somebody tests positive or somebody has an exposure, they can talk to them and ascertain what their risk is for developing symptoms, where they need to go for isolation, whether or not they need to quarantine. So that's one of the very, very important parts of what they do every day. But aside from that, they are masters of, they've internalized all of our university protocols about COVID, from masking to space use to quarantine policies. So they can answer any and all questions that anybody in the community has about anything and everything related to COVID. They should be the first point of contact for anyone who has any questions. If you have symptoms, if you've been exposed, if somebody has COVID in your household, if you are having any questions related to COVID, please contact the care navigation team and let the journey begin from there. And we can help you then figure out whether you need to quarantine or not, when and whether you need to test again, whether you need to go to an isolation space. All of these are things that we do every day. They also help with event approval for people who want to have all kinds of events on campus and need advice, public health advice about size, about mask use, about use of spaces, food, music. All of these questions have public health implications, and the Care Navigator team helps with those as well.
Ranit, we are so appreciative of your leadership here at Georgetown. As we begin the year, would you like to share a message with our students, families, faculty, and staff?
I would love to say that I think everybody, and myself included, and I believe, Jack, you feel the same way. We had a very, very high hopes with the vaccines, and I think the Delta variant put a little damper in our spring there. And I think that we are going to come out of it, but we're not going to come out of it if we don't work together as a group, as a team, as a community. I know there's a lot of uncertainty right now. I know people are concerned, people are worried, but we will get through this. We have the resources at the university to address all of these issues. We're going to work with the DC Department of Health. We really do work with all of these stakeholders, and we will come out of it on the other side. And thank you, everybody, for getting vaccinated and for showing some flexibility and your patience. And more importantly, let's make sure everybody is, that we're leading with kindness and that everybody is kind to everybody around us, recognizing that there's a lot of fear, anxiety, and uncertainty at the moment.
Thank you again, Ranit, for our conversation. And thank you all for joining us for this presentation. I look forward to seeing many of you on our campuses in the coming weeks. Take care of yourselves and take care of everyone around you. for every Hoya, everywhere.